Hi, my name is Kelsey. I'm a student physical therapist. Do you mind if this is recorded for educational purposes?
No.
Okay. So today I'm going to teach you 3 exercises that will hopefully help with your diagnosis of your right hip osteoarthritis, and hopefully it'll get you back to walking up the steps and, get you into that line dancing and back to the aerobic exercise that you really want to do. Okay? So the first exercise that I'm going to show you how to do is called the bridge. And for this exercise, I'll have you can do it on pretty much any flat surface. But the purpose of this exercise is really to strengthen your hamstrings and your gluteus maximus, and it also strengthens your abdominal muscles, okay? So you can be on any flat surface, and you want to push through your heels. You want to focus on lifting your bottom off of the floor and your hips off the floor, and you want to make pretty much a straight line to your knees, okay? So then you can come back down. So you want to hold that for at least 10 seconds, and you bring it back down. You come back up, push your heels, really squeeze your glute max and your hamstrings, and then come back down, and your abdominal muscles as well. Okay? So do you mind go ahead and showing me that exercise just to make sure you have it down? Okay. So your legs look good. All right, so go ahead and push your heels, lift up. You can go up higher than that. Good. Make sure you're not arching that back. Hold it there. And you can come back down. All right, how's that feel?
Good.
Okay. Lift up one more time. Do it again. Lift up a little bit higher. There you go. All right, and come back down. All right, so does that feel comfortable to you? Any pain or anything when you're doing that?
No.
Okay, good. So the next exercise I'll show you, you can go ahead and have a seat on the side of the bed. This is good for your external rotators. So what you'll do is you can sit in a chair if you need to. You can tie this to the leg of the chair. But basically you'll use the TheraBand. You're going to wrap it, put your foot in there, okay, and then just have the TheraBand around your ankle or so. And you just want to make sure you're far enough. You're going to basically get resistance in there on the TheraBand. Yeah, there we go. That's good. There you go. Okay, so what you'll do is you'll bring your right foot over to your left leg, okay? And you'll just bring it just like that. Hold it for 5 seconds. And bring it back down, okay? All right, so you really want to focus on contracting your muscles while you're doing that. You should feel it in your groin area. You're going to keep your back nice and straight. You want to make sure you're not bringing your leg out this way, and you want to make sure you're not bringing it out up this way, okay? So just focus on bringing the inside of your foot to your left leg. Ready? Good. And bring it back down. Perfect. We'll do it one more time. Good. All right. So did you feel any pain or anything during that? No? Okay. So remember, what are the things you want to look for while you're doing this? You want to make sure you're not bringing your leg out.
Bringing your leg out this way too much or up this way.
Yeah, okay, good. All right, so bring that down. All right, so next exercise, let me move this over here. For the next exercise, you're going to do, this is a hip abduction exercise, and for this, you can use a chair, you can use a countertop, pretty much anything that'll help you stabilize. And what you'll do is keep a nice straight back. You don't want to bend you don't want your trunk to follow the movement. You kind of just want to keep everything straight. You're focusing on moving this. So lift your leg out, really contract the glute medius, and bring it back down. Come out, hold it, feel that contraction, and come back down. Okay? Go ahead and try it. All right. Good. 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 All right, Good. Just do it one more time. Try and focus on keeping your pelvis straight, and you're really only just lifting your leg out. Okay? Go ahead. There you go. Good. So you really only want to stretch it to as far as your leg can go, and you want to really control your body. You want to tighten your abdominal muscles and things like that while you're doing it. Okay? Let's do it one more time. Ready? Come out. Good. And bring it back down. Does that feel comfortable to you? Any irritation or pain?
No.
Okay. All right. So you can have a seat. So for those exercises, you can do those. You can also pretty much make any of them more difficult. You could add a stronger TheraBand to the external rotation exercise, and you can always add a weight on your pelvic area as you're lifting up for the bridge. You can add a weight there, or you could use a TheraBand around your waist to resist you when you're lifting up. And you can also add a TheraBand around both of your legs and when you're doing the abduction exercise. So just to recap, what are the things that you want to make sure that you don't do when you're doing the bridge? You want to make sure what is important about your back. You don't want to
arc your back too much.
Yeah, good. And where do you want to really push through? Like, what muscles are you trying to focus on when you're pushing?
Your glutes.
Yeah, and then what are these muscles back here in the back of your thigh? You want to feel those, your hamstrings? Yeah. All right, so those are the things you want to really focus on, and you want to make sure you're getting that nice straight line from your shoulders up to your knees. Okay, and then for the abduction exercise, when you're doing that, what do you want to make sure that your trunk's not doing?
You want to make sure that your trunk is straight and not leaning to one side too much.
Good. And when you're doing that, what's really important about that muscle?
That you want it to stay straight.
Or contract. You want to make sure you feel it contracted?
Yeah.
Okay, so those are the things that you really want to pay attention to. You want to pay attention to the feeling, what you feel when you're doing the exercises. Make sure it's not irritating you anymore. There's a difference between pain and muscle soreness. So soreness is okay, but if you're having excruciating pain, then maybe we should try different exercises, okay?
Mm-hmm.
Hopefully these exercises will help with the stability in your hip and will get you getting back to the things that you want to do. Other than that, for the repetitions, you can start out, you can do 2 sets of 5, but if you feel like that's too easy, because I feel like it may be a little bit too easy for you, you can always do 2 sets of 10, and then you can progress to 3 sets of 10, or 2 sets of 15, 3 sets of 15. You just want to progressively increase the amount of repetitions that you're doing. That way you're really trying to strengthen those muscles and get some good endurance in there. Okay, so is everything clear to you? Do you understand all the exercises that I've showed you and why they're important?
Yes.
Okay, all right, and I will provide you a sheet or a form with the exercises. That way you can take them home and a TheraBand as well. That way you can take them home and you can practice these exercises at home, okay?
Okay.
All right, thank you.
Welcome.